Morning, everybody. Morning, morning, morning. Very nice to see so many people. If I stray from the microphone, you must wave at me or shout or boo or something. I just want to do two things. Rather briefly, I want to give you an overview of where we as a journal are currently, and then I want to do something extremely selfish, which I hope you might enjoy, which is simply tell you how it is that I assess a paper. It's just a personal thing, and I hope you might find it of interest. Where are we? This is where we are. The number of submissions goes on and on and on, remorselessly up. You will go on writing papers. You will go on sending them to us. As you see, a few years ago we had about 800, and now about 2,000 a year. The acceptance rate remains about the same because, as many of you will know, we went from 8 to 12 issues a year to accommodate them, and sometimes we put more papers in an issue. We slip a few more in. The submissions, where they come from, doesn't seem to change very much. The top 3 or 4 certainly remain the same. And further down, the submissions come from parts of the world where we have been particularly interested or where we think there are particular advances which would be of interest to the readership. Thus, you see papers from India and China, for instance, have increased rather remarkably in the last few years. The number of people who we have reviewing for us goes on and on, remorselessly up to, thankfully. And this is, of course, because of having a web-based reviewing system, so we have more people available to us more quickly. And I'm very proud of that. And also I'm very proud of the fact that the number of people who review for us who do not have English as their first language seems to go up and up and up. And I think that's remarkable. I mean, I find it difficult reviewing papers in our language without imagining having to review it in somebody else's language. So I'm extremely grateful for them. And once more, where the reviewers come from seems to, roughly speaking, stay the same, apart from countries where we've done a bit of work, or we've done reviewers' days or journal clubs, or generally spread the message a bit about how we think papers should be written. We do an awful lot of work to try and maintain the lead times appropriate, and I think this is very, very important. And currently, with a lot of work, if you imagine 2,000 papers and 700 reviewers, it's quite a difficult issue, but we like to think that about 90% of papers will get some sort of decision within 6 or 8 weeks. That decision may be that no decision is available, that the first reviewers have disagreed, but at least you will know, as an author, something within 6 or 8 weeks of you submitting a paper, and I think that's important. And furthermore, when your paper comes to be accepted, the time between it being accepted and it appearing in print will be about 4 months. And I'm sure many of you authors here will know that there's nothing more upsetting and boring than having your paper accepted. You've worked all these years for your masterpiece. It's been accepted finally, then you have to wait a year or two for it to be published, by which time you've moved on, you're a consultant, it's history, it's not of interest. So we work very hard, and that is a lot of work, and I think that's very important. We are changing a little bit at the JBJS. We recently polled several thousand of our readers and asked if there were changes within the journal that readers would suggest. And so we are going to put more instructional material in the journal, and we've got some very good instructional material coming up. Many readers wanted more specifically, more online material, particularly for trainees at the end of their training and those coming up to the exam, and so we put more of that sort of material on our website, and I'll just show you one or two of those sort of things. We're currently building a new platform, as everybody is. We'll have a new platform and a new website, a new homepage as of the beginning of next year, and you should keep a lookout for that. The sort of material that people wished for online were focus-ons. This is 1,000, 1,500 words that just summarize what is going on in a small area so that you could, if you like, bite it before going to an exam. And this is just one of them, which knee scoring systems, why, where do they come from, what are the differences between them in a bite-sized chunk. And I can recommend this bit of the website to you. There are many focus-ons, and they are very popular. We also put an exam corner on because people wanted one, and we do this every month. And again, this is extremely popular for people coming up to the exam. I am very, very, very obsessed with journal clubs, as some of you will know, because I know that that is the time when you learn how to look at papers critically, how to look at the methodology, and how to dissect and criticize them, and that makes a tremendous difference to your practice in orthopedic surgeon, and that's not an opinion, that's just a fact, of course. And there are many different ways in which journal clubs can be undertaken, and we put on our website, because people have asked us to, the reports of journal clubs around the world. Of course, we have apps. Everybody has apps, and on your iPhone now, I'm afraid you can only get the abstracts, but you can get a feeling for what the journal is up to on your iPhone. We have a new journal, an online open access research journal that's coming out any minute. I have thought for a long time that we as a journal rather let down the research community for various reasons, which I'm happy to discuss. And so we persuaded Andy Carr at Oxford to edit this online open access research journal, and we have, the first submissions have just come in, and it'll be out available to you any minute. We have those of you who are interested in learning how to review and learning how to look at material critically. We have reviewers' days at the journal at their offices where Frank showed you in the middle of London, where we have 30 or 40 people for a day, and we discuss how to write, how to review, what open access is, how to fashion an outcome study, what statistics are needed in orthopedics, all the sort of things that are important to the generation of a paper. And if you wish to come, look it up on the website, and you'll see these are the ones, the next ones. There's one in a couple of weeks' time in October, and a couple so far we've got organised for next year. And if you want to come, look it up. Okay, now I'm going to tell you very, very, very quickly, and I hope you will forgive me for telling you how I review a paper, because it's a very, very, very simple system, and I can recommend it to you all. At the end of the day, of course, what you're being asked to do is to decide if this paper should be rejected, if it needs to be resubmitted, or it needs to be accepted. And when you're coming to this decision, this is what you need to ask yourself all the way through while you're looking at the paper. Is this new information? Do I not know this already? If this is a debate, if we're talking about the debate between cruciate substituting and cruciate replacing, between cementless and cemented, if this is a debate, is the debate advanced by this paper? And that's a very, very, very important question to ask yourselves. It may be fascinating, but is the debate advanced? Have we actually moved anywhere as a result of this paper? And will it simply affect clinical practice? So next time you have a scalpel in your hand with somebody needing a cruciate ligament reconstruction, will you do anything differently as a result of this paper? These are very, very, very fundamental, important questions. I personally think that the strengths and weaknesses of papers are very, very, very important. And it's important that the authors understand the strengths and weaknesses of their work, and important that you as an evaluator, as a reviewer, see that there are limitations to the work and that they are outlined. I personally think it's important to look at each element separately and to separate your own views about each separate element. And I personally go to the last sentence of the introduction always. I don't read the beginning. Go to the last sentence of the introduction, because as Frank said, this is where you will get the question that is being asked, and you will know straight away if this is of interest to you. We therefore chose to further investigate the causes of anterior knee pain after cruciate ligament reconstruction, or some such. Do we not know enough about this issue? Anyway, you will find a question here, or you will find a hypothesis. Our hypothesis was that the outcome after arthroscopic decompression of the rotator cuff did not depend upon postoperative physiotherapy, or some such. So there'll be a hypothesis or a question. You will immediately know how interesting this question is. And then, of course, I immediately want to know what design of study was chosen to investigate this question. A very, very, very straightforward question. So I look above or below, and I see whether they have chosen an observational study, is this a prospective randomized controlled trial? What type of study is it? And is this an appropriate way of looking at this question? Should they have a control? Is the design right to answer the question? And I want 2 sentences, too, also telling me why this question is still important. Only 2 sentences. If you think that anterior knee pain after anterior cruciate ligament reconstruction still needs to be investigated, you need to tell me why. So I need to know why this question is still important. Okay, I know the question, I know the design. I put prospective with a question mark because I'm always very suspicious of the word prospective. Authors like the word prospective. Everybody likes the word prospective. And in general, of course, often, when you're looking at these material, we did a prospective trial. You need to be very careful that this is not a retrospective look at prospectively gathered data, which is a very, very, very different kettle of fish. So you just look at the word prospective and question it. Okay, I know the question, I know why it's important, I know the design of the study. Now, in the material and methods, how many patients were chosen to investigate this issue? And is this an appropriate number? Was a power study undertaken? Very, very, very important. Were these patients consecutive? If they were not consecutive, does it matter? Have the authors adequately described whether these patients are consecutive or not? And are the demographics appropriately set out? Usually in a table, of course, but are they all appropriate? And if, for instance, if this is a case control study, do the cases and the controls match at every level of the demographics? Very important, very simple. If it's a case control study, how are the controls chosen? Were they chosen appropriately? The inclusion and exclusion criteria, very, very, very important. Very simple. All this is terribly simple, but you'll be surprised how often it is not done. And it's so easy. Inclusion and exclusion criteria, if you are imagining a paper about patients with osteoarthritis of the hip, have those with osteonecrosis been excluded? Have the rheumatoids been excluded? Does it matter? Is it important? Have the authors told me which patients have been excluded? Again, how are the controls chosen? Very important. If this is a randomized control trial, increasingly we need to know the method of randomization that was chosen, because there are lots. Was a coin tossed? Did sister open an envelope before the scalpel was raised? What method of randomization, and was this appropriate? What tests and measurements and outcome scores were used? Were they appropriate? Have they been validated, for instance? And if they have not been validated, does that matter? There are many outcome scores, as many of you will know, that are used again and again in papers in orthopedics that have not been validated. Does it matter? If a new outcome study is being proposed in the paper, have they validated it? The validation is important, but not that important. It's just important that the author should understand how important it is, if you see what I mean. And you need to know, of course, who has measured the outcome. Whether it's the patient, whether it's a physiotherapist, whether it's an independent surgeon, and whether they are blinded. Very, very important and very simple. And the outcome scores, you need, of course, to know that the units are appropriate, because sometimes, if you look at, for instance, various of the Oxford scores, they've been modified here and there. You need to know which score is being dealt with and whether it's being described, and if the unit is appropriate. Okay. I know the question, I know the design, I know the background, I know how many patients, I know what they've done. Now, how many, of course, have been lost to follow-up, finally, in the patient method, is very, very, very important. At what stage were they lost to follow-up? At the stage that they were lost to follow-up, were they included in the analysis? Very simple, very straightforward, 3 sentences only, very, very important. What period of time was chosen? Very important, because we all know that the outcome after decompressive surgery for disc disease, you know the morning after the operation, you wake up without sciatica. You know now that in order to write appropriately about arthroplasty, you may need 10 years. If you're a pediatric orthopedic surgeon concerned with the surgery of DDH for acetabuloplasty, you may need 30 years. I mean, what time was chosen for this study, and is this time appropriate? The way in which the survival figures, the life tables, are described is important. It's very clear. It's laid out in various papers that many of you will be familiar with, and the Kaplan-Meier method of doing it is very well described. Ethical approval, of course, very, very, very increasingly important, and informed consent. The statistics, I take little notice of the statistics. I think that if the statistics are very important, I would ask a statistical reviewer. However, I do know that if you have a p-value, you need it. You don't need to know that it is below 0.05. You need to know what it was, so as to know how nearly significant it was. And I also, of course, know that confidence intervals have a little bit more clinical value, whereas p-values have more statistical value. And I also know, because I've been doing it a bit, I know what equations, I know the names of the equations that are appropriate to looking at many parametric values, for instance. But if you don't know, of course, and you are a reviewer, and you think the statistics are very important, then you should simply say in your review, you don't understand the statistics, and then we'll find somebody who we hope will understand it. Okay, we know what they're doing, we know how they did it, how long they did it, for how many patients. In the results, you'll be surprised how often the numbers of the patients that the authors are reporting do not match the numbers that they put in. And you would think, this has taken 10 years to do this, you would think that they would have worked out how many people at the beginning and matched them with the number at the end. And it is usually a very simple, straightforward error relating to bilaterality or percentage or something. But again, just check it and you'll be surprised how often it is inappropriate, it's wrong. Are the results very, very, very clearly presented? You do not need information in text as well as in tables. Very straightforward issues. Do the legends, the radiographs, do the radiographs show what they're meant to show? Are the legends appropriate? And again, you check the numbers, the outcome, the follow-up, everything that was told to you in the patients and methods is appropriately presented in the results, so that the same tests by the same people were reported. Sorry, the discussion. I only want the discussion to deal with a question that was outlined to me at the end of the introduction. Authors get very excitable, and they go off on a tangent to deal with all sorts of issues that they think are very important relating to this debate. I only want to be told what is important, what we discovered as a result of this investigation in relation to the question that I told you I was going to work on at the end of the introduction. I also want to take a view about whether the results support their conclusion. Because again, authors get excitable and they think their results, wholly rightly and appropriately, they think their results maybe are a bit more forcible than their conclusions are a bit more forcible than the results would suggest. And this is a very important issue, of course. I like the strengths and weaknesses and the limitations. It would have been better if in our control group we'd run it up. It would have been better if we'd had longer follow-up. It would have been better if we had included, but whatever. It's very important that the authors tell you what they think is good and bad about the material that they have presented. And at the end of the day, of course, how does this now affect our knowledge in relation to the question that was identified at the beginning? Where do they fit in? Now we look at the references. There are those people who look at papers who, in order to begin their evaluation, will look at the references first. You can tell an awful lot about a paper and about authors by looking at the references that they've chosen before you've started. I look at it now after I've looked at the discussion. Are they up to date? Very, very, very important. Almost all reviewers will do a limited literature search of some sort, so you need to be aware of the fact that references need to be up to date. And with the speed with which things are changing, this is a very, very important aspect. And are they inclusive? And are they biased? If there is a debate here about arthroscopic or open or about cemented and cementless, have the authors biased the references that they've chosen? Because the likelihood is that they have, but you just need to be aware of this and look at it critically. Are there too many references? As Frank says, it's very, very, very easy to put in too many references, and it is wrong. All you're essentially trying to do is to impress your readers, or indeed the editor, that your reading has been so wide that you managed to find 15 references to cite against a simple statement. And are they appropriate, and are they relevant, as Frank said. Now, then I come to reading the abstract, and this is far and away the most important part of the paper. It is the bit that will be much the most read, and for our journal we need a concise bit of prose exactly doing just what I have said. So the first sentence goes, "We wish to," and then the next sentence goes, how we did it, what the design was, what the results were, where it fits into our knowledge. Finish. That's all you want. Short, clarified, and easily understood. I don't want levels of evidence. We can talk about levels of evidence forever, but I personally don't want levels of evidence underneath an abstract. I know that if you put levels of evidence underneath the abstract of a paper, you readers, of course, will look at the level of evidence. You will see it says that this is a level 1 or level 2 study. Your eye will go one line up. You will read the last sentence of the abstract, and that will be the extent of your relationship with this piece of information. And that, to my mind, is wholly, absolutely, and utterly wrong. I like to think that you have begun at the first sentence of the introduction, you've got to the last sentence of the discussion, and you have formed a view as to how important this piece of information is, that you therefore are independent and you have not been told by the authors, or much worse, by the editor, how important this piece of information is. You have decided. So I don't put levels of evidence under the abstracts of our journals. Then I look at the title. And titles can actually, of course, be very misleading. Does the title actually reflect that has happened? Is there a subtitle? Is the subtitle appropriate? And there you see in small letters, start again. So I've done the first bit, I know just what I've described to you, and I have a fair idea of what it's about and where it might fit in, and then I write for the editor simple things. Is this original? Is it controversial? What are the strengths and weaknesses of it? Does it advance knowledge? That I was saying at the beginning. Will it affect practice? Do I care at the end of the day? Does it matter, this paper? Now, I can't tell you how strongly I can recommend that to you. It took me quite a few years, I'm ashamed to say, to work out that that was the most satisfactory, easy way of looking at papers. And if none of you have done it before, what I suggest you do this evening, tomorrow, when you're at home, look at a paper in our journal and just go through it in the way that I've described, a paper that is in your area of special interest. Go to the last sentence of the introduction, bang, bang, bang through it in this way. And if you want to be reminded in a very simple way of what it is, how it is that I've guided you through looking at a paper, if you go to the instructions to authors on our website, you will find I put these up, which is essentially just what I've told you, how to evaluate a paper. And many reviewers email me to say they find this very useful, as indeed, of course, also do authors. I can recommend that to you. And, of course, you will enjoy it. That's the most important thing. It's got to be fun. Anyway, that's how I do it, and I'm very grateful to you for listening to me. Thank you very much.
Well, thank you, James. Now, Marius Scarlett from Toulon is going to speak on evaluating